We're trying to get people to give much more effectively and give a little bit more. Because the collective, the multiplicative factor here ends up leading to huge, huge bonuses, huge, huge advances in how much good you can give. So, going back to the idea of the talk, the idea with which I started, this recipient-based view of charity. How can you do this? If you've been impressed by these ideas, if you think that effective giving is something that matters to you, something you'd like to give, how can you go about doing that? Well, as I've said, it's really important to not just think about how much you're giving. How much you're giving matters, but it's not the most important factor. So when you're evaluating your own giving, deciding how charitable you've been, when you're evaluating somebody else's giving, don't simply look at how much you're giving. As an example of this, think back to Joe Biden, who we all laughed at. I'm not saying this is the case, but his $995 could have done more good than John McCain's $100,000 if it was given to the right causes. But I don't think it actually was. But if it was, it could have accomplished more good. And then I would say there's a sense in which Biden's generosity would be more virtuous than McCain's, even though McCain gave up 1,000 times as much, 100 times as much. Okay? So don't think just about how much you're giving. Instead, think about how much good your money is doing. Whether or not that's all there is to generosity is certainly a part of it. This idea of getting your money's worth, I mean, it's something that we do in so many other contexts. When you go out for dinner, when you buy clothes, when you rent an apartment, when you buy a computer, you don't just look at how much you're spending or how much you're getting. You weigh the two. You want to get as much as you can for as little, as little outlay as you can. We think about cost effectiveness in all these other contexts. Well, think about it here too. If you're giving away $2,400 to charity, that's a lot of money. You could get a lot of stuff for yourself for $2,400, so why don't you make sure you're actually getting a lot of stuff for other people with that money you're spending? So think about getting your money's worth. And now, here's the hard question. How do you do that? How do you figure out how to get your money's worth other than, Drew said that deworming was really cost effective, so I'll just do that. How do you do it? Well, unfortunately, and this is the bad news, the ways that people typically evaluate charities are at best meaningless and at worst counterproductive. So if you go online and you do a Google search, you will come up with hundreds and hundreds of organizations that purport to rate or rank charities. On the news, people will talk about it all the time. This is not an uncommon thing to do. The metrics, the methods that people use to rate these charities, though, are almost always very bad. So these are the kind of things they focus on. The percent of a charity's budget that gets spent on salaries and overhead versus the percentage that's sent directly to recipients. That's the most common one. People will look at salaries paid to executives. People make a big deal out of the fact that the CEO of UNICEF makes 20 times what the CEO of the Salvation Army makes. Fundraising expenses. How much money does a charity need to spend to raise more money? I'd rather give to a charity people think that only needs to spend $100 to raise $1,000 as opposed to one that needs to spend $500 to raise $1,000. Donor satisfaction. Do people keep giving year after year? Transparency. Okay? These are the methods that people usually use to rank charities. And let me explain now why these are very bad methods. First of all, in terms of salaries paid to executives, you can already see the reasoning. If the CEO of UNICEF is that much more active and is that much smarter, is able to use the money that much more effective than the CEO of the Salvation Army, then that's a good way to spend your money if you're UNICEF. Hire the CEO who can really get things done. Fundraising expenses. So suppose that you have to raise money for a charity. Would you rather, if your job depended on it, raise money for kids struck with cancer, childhood cancer patients, or deworming in Kenya? It's really easy to raise money for children with cancer. Okay? You put, picture on the screen of a child, pale, fatigued, in a hospital bed, thin, right? It's really easy to arouse sympathy or something like that. And it's a good cause. I'm not saying it's not. But it's really easy to raise money for that. Deworming in Kenya, though, it's a harder sell. Okay? Most people in the United States don't even know what these worms are. They're like, earthworms, what are you talking about? Okay? So people don't even know what it is. If they do know what it is, they don't have any direct experience of it. Everybody knows somebody who's died from cancer. I don't think most of us probably don't know anybody who's had a parasitic worm infection, or if you do, you don't know many people. The victims of this infection, they're not dying, so you can't just take a picture of them and see the effects of these worms. Okay? They're far away, that makes a difference. Whether it should or not, it doesn't matter. It makes a difference in terms of fundraising. And generally, and I hate to say this, they're not as cute. Look at somebody, a child in a hospital bed versus somebody in a poor African village. It's easier to arouse sympathy for someone who looks more like you. And for most of us, that's the person in the hospital bed in the United States. So, if you're going to raise money, it's a lot easier to raise money for whatever, childhood cancer patients, than it is to raise money for deworming. But does that mean that childhood cancer is a bigger problem than deworming, is a better charity than deworming? No, it doesn't mean it. It just means it's harder to make people give. So fundraising expenses is a bad way to measure the kind of effective work a charity is doing. Let me now end this section by talking about the big one. So this is the statistic that you're going to see mentioned all over the place. Percent of income spent on overhead. Okay? At Claremont McKenna College, there's one of the neighboring colleges has a fundraising drive, and the information they give you about the charities they want you to donate is this piece of information. They tell you how much of your donation is going to go to directly helping people versus how much of it is going to go to salaries, things like that. Here's why that's a really bad and, in fact, counterproductive way to rate charities. Suppose we have $1 million, we're a charitable organization, we have $1 million, and we want to use it to fight malaria. So one thing that we could do is we could spend the whole $1 million on mosquito nets, bed nets, and go to parts of the world that have malaria problems and give those nets out. Okay? If we do that, we can then report to these organizations that 100% of our budget was used to directly benefit people. It all bought mosquito nets. And so we're going to get an A+ on this kind of grade here, this little metric. But here's a much better way to use that $1 million. Instead of buying $1 million worth of mosquito nets, why don't we buy $800,000 worth of mosquito nets, $700,000 worth of mosquito nets, a lot, but not use all our money, and then let's take the $200,000 or $300,000 that we have left over, and let's hire a public health expert. Let's hire an epidemiologist, an economist, a statistician, someone to go and check if these nets are having the impact we think they are. Are they really making it to the people who need them? If we spent the whole $1 million on nets, we have no way of knowing. If they are making it to the people who need them, are they actually using them? So a problem with some bed nets is that they're too complicated to use. They have like hooks all the way around, so going to bed is a 20-minute process. People just stop using them. Okay? If they are using them, are they using them correctly? Some nets need to be re-dipped in insecticide periodically, and so giving the nets to people, if they don't go back and re-dip them every once in a while, it doesn't do any good. So we need to check on all these things to see. But if you do that, if you only spend 75% of your budget on nets and 25% on hiring economists and statisticians, you're going to get a C from this evaluator, and no one's going to give you money. So you can see how this focus on percent of income spent on overhead, it's not just useless, it's counterproductive. It's a bad way to measure effectiveness. Okay? So I told you what a bad way to measure effectiveness is. What's a good way to measure effectiveness? How can you get this kind of information if this is something that you're interested in doing? Well, one thing that you can do, there are a lot of academic research institutions that are dedicated to collecting this kind of data, publishing papers like this. So these are the places that I got the information for this talk. You can go to the website for just about any one of these things. And there are a whole bunch of papers you can download. I actually worked at this one for a little while. You can download papers, and you can see them evaluating the cost effectiveness of mosquito nets versus insecticide spraying for malaria. You can see them evaluating the effectiveness of antiretrovirals in general versus targeting pregnant women. You can read papers on that stuff. Now, of course, this is hard work. Academic papers are usually not, page turners. It's kind of boring. There's a lot of papers to sift through. So you might wonder if there's an easier way to do it if you're not that excited about dedicating the next month of your life to reading all these research papers. Happily there is. There's a small but growing number of organizations which are dedicated to doing what I just said for you so that you don't have to. Going to these kind of websites, reading the reports, evaluating charities that do these things, and then coming up with specific recommendations, telling you these are the places we think that you can have the most impact if you give your money. So I'll mention two of them here. One is GiveWell, givewell.org, and the other is givingwhatwecan.org. Okay? Go to either one of these websites, and you're going to get good information. I should mention, the two organizations differ on a lot of points. They evaluate things differently. Giving What We Can tends to focus more on economic evaluations of cost effectiveness. GiveWell considers a lot of other factors. and they're more skeptical of certain economic reports. So there are differences here. Giving also evaluates domestic charities. Giving What We Can focuses only on international ones because you can have a greater impact abroad. But whichever one of these you go to, despite the differences in methodologies, either one of them would be a great place to get information about how you can give effectively. So that's where you can go if you're trying to get this kind of information. So, according to my buzzer, I have 1 minute left. So let me just wrap up by talking about Taking the Pledge, about this organization that I'm here to talk to you about, that's sponsoring the talk. As I said, one of the things I really like about Giving What We Can is that they have this more Aristotelian idea in mind, where giving is more than simply how much you sacrifice. It's about what you can accomplish. That matters. A lot of people don't seem to think that way. And further, they recognize that where you give, the programs that you give to, that's much more important than how much you give. Because as I said, they're asking for only a small increase in giving, 2.5% to 10%. Now that may sound like a lot, and 10% is a lot compared to what most people give. But think back to the Peter Singer article, the one with the drowning child, that I mentioned about 45 to 50 minutes ago. Peter Singer would say 10% is not nearly enough, because even after you give them 10%, there are still lots of people who still need your money. So if you bought the argument of Peter Singer's article, 10% isn't the right amount to give. You should be giving 30, 40, 50, 60% of your income to these causes. Giving What We Can doesn't ask you to give that much, because as we saw, giving more is not the key to more effectiveness. The key is giving more effectiveness. So Giving What We Can is asking for a small increase in giving, but a big increase in effectiveness. That's how you can have the greatest impact. So I'll close by showing you what you could accomplish. Said that the median starting salary for UCSD graduates is $48,000. So if you were to give away 10% of that, which is what the pledge says, that would be $4,800 a year. So what could you get for that $4,800? Well, you could distribute 960 mosquito nets, which would prevent 2,600 cases of malaria and save 8 lives. Or you could cure 240 people of tuberculosis, which would prevent 10 people from dying. Or you could provide 1,600 additional years of school attendance by sending deworming pills to places like Kenya. Or you could add 1,000 years of life, collectively, through things like preventing maternal transmission of HIV. Look at that impact. That's huge. And now think about what happens when you read the news. You read a news story about somebody who runs into a burning building and rescues a child, saves a life. A lifeguard, pulls a drowning child to shore. A soldier rescues 2 comrades who are stuck behind enemy lines. Okay? A teacher stays after school to provide extra education for students who are underprivileged and are not getting the material, who can't read and say. We think of those people as heroes. And I'm not saying that we shouldn't, but we think of them as heroes. And what they're doing is they're saving a life or 2. They're getting students an extra few hours, or maybe days or weeks, or even a month of schooling over the course of a year. Well, look at what you could do with your donation. You wouldn't be saving a life or 2, you'd be saving 8 or 10 lives. You wouldn't be providing a few extra hours or days of school, you would be providing a few centuries of school attendance. Okay? The impact you can have is much, much greater than the kind of impact that we usually describe as making somebody into a hero. And the even more exciting thing is that this is not what you could accomplish over the course of your whole career, over the course of your whole life. This is not like, if you join Giving What We Can today, then 50 years from now you can look back and say, I saved 8 lives. This is something you can do every single year. You can do it this year, you can do it next year, you can do it the year after. You can do that every single year. Think about what you would say about somebody who ran into a burning building and saved a life every single year of her life. You could do 8 times that every year if you wanted to. Okay? So I hope that the things that I've said today will lead some of you to consider being a part of Giving What We Can in some way or another, either by taking the pledge or just coming back to more of these talks. I hear Thomas Pugga may be coming later in the year, and if he comes, he'll talk to you about different ways that you can use your money and achieve huge benefits, different ways that you can have this kind of impact. So I hope you'll consider doing that, but even if you don't, even if you decide that you're not going to give 10% and this lecture is too boring, and so you don't want to come back and hear somebody else do another thing for an hour, even if that's your decision, think about this idea of effectiveness. Because even if you don't increase the level at which you give, even if you just give that 2.5%, than most people give. If everybody in this room gave that 2.5% in a very effective way, the collective impact we all have would be astounding.